Good morning, guys, and welcome back to another video. So I'm just going to hop right into the video today because I don't want it to be too long. I told you guys I was going to do a Q&A regarding working in the urgent care as a nurse practitioner. And oh my gosh, you guys asked me so many questions, so many really good questions. Obviously, a lot of you are considering or have considered working in the urgent care as a nurse practitioner. So yeah, you guys had a lot of really good questions. I'm going to try and not edit this too much because editing, sometimes I get like OCD and it takes me forever. So I'm going to try and minimize my ums and my ahs, but bear with me. And I'm just going to try and hop right into some of the questions. Look, I asked you guys on my Instagram, on YouTube, and Facebook, so I kind of have to pull from all the different places. So I have my phone here, and I'm going to just read through your questions, and I'm going to answer them to the best of my ability. Okay, so the first question that I'm going to answer, who do you contact if you have a question and you don't have the answer? So technically I have two overseeing physicians that I work with in the urgent care setting. Both have some ownership in the practice, and often they're not there. One is never there, and then one is only sometimes there. And so, but those are technically my contacts that I would call if I have a question. One is a ER physician that I actually worked with in the ER previously, and so I just text him. He's really quick about texting me back if I have a question. And then the other physician he works internal med at the office that I work with as well. And he's not there as often anymore because he owns the practice. He just doesn't work as many hours. But also definitely, too, I could reach out and ask him. So those are like the official people that I would reach out to if I had a question. That being said, right when I started working there, I made a couple of friends, a couple of colleagues that I work with that I felt comfortable just asking like really quick, brief questions. I could shoot them a text or whatever. And I have those resources too. Plus, I always have like my textbooks and whatnot, of course, if I needed to. So I have definitely some people that I can reach out to if I have questions. Okay, so where was I at? Do you get to shadow after graduating, or did you hit the ground running on day one? Okay, so another really good question, and a lot of people asked a variation of this question, like what was my training starting as an urgent care, starting as a new nurse practitioner in the urgent care. So my training was not much. I'm going to be completely straight with you guys. I mean, yeah, that was kind of hard. So I had 2 days of training. Both were like 3 hours or less that I basically shadowed somebody, and then I was on my own. And so I definitely, again, had a lot of anxiety. But like I said, I shared this office with multiple other providers. Even though they were working for like internal med or something else, I still had this sense of security that like if crap really hit the fan, like there were other people there. And so maybe that's why they felt a little bit more comfortable giving me a little less training, because they knew at the end of the day there were other providers in the building. So if something went really bad, or if I had an immediate question, I do have people that I can go to during the week. On the weekends, it's not the same. Internal med isn't there as much, but still, like, that was a sense of security, just knowing that there were other doctors there. Although I'll be completely honest with you guys, they don't want to answer my questions because they're so busy. They're so busy with primary care, and so I very rarely will ever ask anything of them. Love them. They're great doctors that I work with, but they're just super swamped themselves, and so it's not like I can go to them all the time. But they are there in case anything went completely awry. And so, yeah, my training was very limited. That being said, I come from, and someone asked me this too, my experience for nursing definitely played a role in my ability to transition to working in the urgent care. So I did 4 years in the ER as a nurse, and then I did a year in the float pool after that, most of which I did in the ICU. I did a lot of training in the ICU, and I really liked the ICU. And then I also did PCU, which I did not like. You guys, seriously, and I'm not saying because I didn't like the job, like I was above it. I'm saying it like the job was so hard that I could not get out fast enough. But that's another conversation. And so that was my experience, which definitely helped. And I also did precept at this urgent care that I'm working at. Granted, it was my first clinical that I had ever done, and so I was kind of like a lost duck. But I did precept there, so I had a little bit idea of like the flow of how the urgent care was run, and so that definitely helped. All right, so the next question, did you feel confident in treating patients after graduating? No. Did not. No, I had many little bit of nervous breakdowns. I don't feel that way now. So let me tell you, there's light at the end of the tunnel. I think a lot of people feel very anxious when first transitioning to like all of a sudden a provider. I remember still, I will probably always remember my first patient working as a new nurse practitioner, and it was a rash, and like I just remember seeing like all the chief complaint said was rash, and I still am not a huge rash fan, and I just remember thinking like I was like sweaty and like dizzy. I'm like, okay, I had to like talk myself down for a minute. And I got lucky. It was pityriasis rosea or whatever, and I had actually just reviewed it. I got very lucky, okay? And that's exactly what this guy had. I was so excited when I first walked in there. He probably could like sense my nervousness, but I like quickly evaluated him, and I was like,
I'm pretty sure I know what this is. You know, dermatology definitely is in my area of expertise. Let me just reference something really quick, but I'm pretty confident I know what this is.
And I actually went and looked at my book, and I came back. So, and he was very understanding about that, and that's how my first encounter went. Girl, I was nervous, let me tell you. And there was many a times that I would go home and question what I was doing, and just like, it was a process. But I got through it, and I know that I'm not alone. A lot of people feel those anxieties when transitioning to like a provider role. So if you feel that way, you're not alone. It's totally normal, but work through it because it gets better. Okay, so the next question is, did you start out there as a solo provider, or was there another NPPA or doctor there? I am generally the only urgent care provider. Like I said, there are other people there, but I'm generally the only urgent care provider when I'm working, or there's a couple hour overlap with another one if they split it like into 2 shifts in the day. But usually I'm the only one. Not a question, but I absolutely love your channel. Thanks, I appreciate it. I love this community, and I love doing this channel, so that is awesome. Thank you for that. Favorite urgent care or procedures course? So I didn't take any courses for urgent care, you guys. I'll be honest, and a couple people asked me this question too, and I didn't. I worked in the ER, like I said. I did my precepting in the urgent care, at least one rotation, and I knew that I like emergency medicine or urgent care medicine. Okay, so the question was, you know, what courses? So I didn't take any courses, like I said, but what I will say is that I am not uncomfortable with asking people to teach me things, and I definitely encourage you to do the same. So like I said, we have like a general surgeon that works in our office. I've asked him many different questions about like suturing skills. I asked another doctor that I work with to kind of help me with my ultrasound skills. I did purchase like one of those like suturing kits, one of the ones that I gave away in my previous videos, and I practiced suturing so much at home. And IND, I think I watched a couple videos on YouTube for like learning INDs, and just really found avenues to learn. And I never paid, well, except for the suture kit, which was not very expensive. I didn't really pay anything for it, but I never hesitated to ask people. So hopefully you have some ability to like network and ask people around you to teach you, and usually I feel like people are pretty receptive to that. I made a video about, and I'm going to say this a couple times because there's a couple applicable videos that I made super helpful for working in the urgent care. So I made a suturing video, and I really recommend that you watch that and then somehow find a way to practice the skills. Even if you just get one of the kits and practice at home and watch that video, you'll be okay. I mean, there's going to be a first time for everybody. And so you have to know that you're never going to be 100% professional right out the gate. You're going to have to learn, and so hopefully that gives you a little bit of grace and remembering that everybody has the first time. That being said, you don't want to sew somebody up and have no clue what you're doing and like make a big mistake. That would be not good. But at the end of the day, if it comes to that and you're like, hey, I don't have the skills, I can't do this, then you send them to the ER. That's all you can do. Don't try to do anything if you don't know what you're doing. I watched a ton of stuff on YouTube. Editing Brittany here on my phone, so there's going to be a little bit of a quality changer, but I had to point out one thing really quick. So saying I watched a lot of things on YouTube, I just wanted to say, don't let anyone tell you that everybody doesn't do it. I have watched doctors, PAs, nurse practitioners, you name it. I've watched them look stuff up online, on Google, on YouTube, before they go into a patient's room. I have spoke to doctors and residents that have watched YouTube videos before going in to put in a chest tube, okay? Not to say that they didn't research it and learn and everything, all those things, but we all look it up sometimes and we're like, hey, I need a refresher. pull it up on YouTube, Google, you know what, no one's above it. Don't let them tell you that they are. I read a bunch of stuff on Up to Date. I got one of the suture kits, like I said, practice at home on like odds and ends crap all over the place. I have little stitches everywhere, and I made do. Definitely watch that video that I made. It helps a ton with just like learning technique and giving you some pointers on how to properly suture. And then, like I said, there's also really helpful videos on YouTube for like INDs and stuff like that. Sorry that I don't have any recommendations. I did, because you asked me, I Googled just to see like suturing courses or urgent care skill courses, and some stuff popped up for different courses that are available. I just can't comment on them because I have never done them, but maybe they're good. I don't know. Alright, so on to Facebook. You guys asked some really good questions here too. Okay, so what kind of nursing did you do before NP, and how did you know you wanted to do urgent care? I already answered this too. I did ER, then float pool, which is ICU, and PCU. I also did a little bit on the side of like home infusions, and I knew that I wanted to do something that involved like hands-on skills. I really think I would have liked surgery. I like talking with people and I am a people person, but I also really just want to do like hands-on stuff. And so I did know that I wanted to at least start in urgent care, because I felt like it was the closest to what my experience had been. Like working in the ER, if you've worked in the ER, we had something called like a fast track, which is essentially like an urgent care inside of the ER, and I'm confident now that I could basically run a fast track on my own. Best conferences or resources to spend CME money on? See, again, that was the question that I'm like, ooh, I don't know. I'm sorry. I need to look into this more too, because I need to be doing this stuff. I was going to reach out to somebody and ask them, and if I find that, and ask them their recommendation or what they see. I'm always asking people too, you guys. I'm learning right with you. I need to look into this too, though, because I'm already a year in, and I know that this is going to fly by, and I'm going to need to get my like continuing education and stuff like that. So I'm going to look into this more, and maybe I'll make a video just about stuff like that. As a new grad, how did you become successful in urgent care, especially with no prior ER experience? Well, I did have ER experience, so let me continue on with that and say, I think you can be successful working in the urgent care without ER experience. Really, the frame of mind has got to be, when working in the urgent care, can I manage this outpatient safely, or do they need to go to the ER? Really, the biggest part about working in the urgent care is ruling out true emergencies from something that can be managed outpatient safely. What was the transition like going from the ER RN experience to urgent care NP? Do you ever feel like you are missing out from the hustle and bustle of the ER? Really good question, because yeah, I do. I miss the ER. If I could go back in time and just like have a day pre-COVID, right? Because COVID kind of screwed everything up. But working in the ER just as a nurse, like, I don't know, it was such a good time, and it was so fun. I learned so much. I saw so much. And I do definitely miss the ER. That being said, we are so busy at the urgent care I work at. It's not like I don't miss like hustle and bustle, because we are hustling and bustling in the urgent care, but I miss like higher acuity of stuff, I guess. Like I really like more critical care, or like ICU even. Like I really liked higher acuity patients. And obviously that's not really, I mean, every now and then we have some like pretty critical patients that come to the urgent care, very rarely, and I always wonder, like, why did you come to the urgent care when you have this sharp left chest wall pain radiating down your arm, and you have like a history of stents and all this? Every now and then we do see stuff like that in the urgent care, but generally you don't see that high acuity of patients, and so that would be what I really miss from the ER, and that's why I sometimes consider wanting to go back. The transition was super easy though. If you work in the ER and you go to the urgent care, I think the transition is super easy. When you first started, what were some chief complaints that made you nervous to see on your own, and why? That's another really good question. Chest pain always made me nervous, because EKGs are something that I find tricky. I can pick out really like basic stuff, basic rhythms. So that being said, I take into consideration like my clinical exam. I mean, I've gotten much better with interpreting EKGs. I'm no cardiologist, but I take into obviously consideration my exam. If this is an elderly patient with chest pain, even if the EKG looks normal and it's non-producible, like it's not like not musculoskeletal, because that is always something that you can really quickly rule out. Do you think it's musculoskeletal? But if it's not, if you can't like determine the cause of why this person is having chest pain, I have a very low threshold with sending those patients to the ER, because they just need a further workup anyway. An EKG only shows you a snapshot of time. And so they need like troponins and like trending troponins and just further workup than anything that I'm capable of doing in the urgent care. That one made me nervous. Dizziness made me really nervous, and that doesn't make me as nervous anymore because predominantly that is vertigo, and it's really easy to determine if they have vertigo. You can do like the Epley maneuver, you can look for nystagmus, different questions that you can ask. Is it exacerbated by head movement or movement in general? Do they have like an upper respiratory or viral infection going on as well? Is the room spinning, or do they feel like they're going to pass out? And like those are usually the things that I ask for with like the dizziness, and now I feel like I've got that pretty good. If it's not exacerbated by movement and they feel like they're going to lose consciousness, that takes you down a little bit more of like a critical path. And then again, I take into consideration my exam again. Is this patient elderly? How is their neuro exam? How's their blood sugar? How are their vitals? And so that has made me less nervous now. But chest pain and dizziness were definitely the two that made me most nervous. And chest pain is still one that I'm like, oof, I don't love it. But I've gotten better with it. Dizziness, I feel much more confident. What are the top 10 ailments seen in urgent care and the best way to quickly assess and treat? Oh God, girl. That's a really good question, but I feel like that could be a whole video. Let me just see if I can do this. Top 10 ailments. Upper respiratory something. Like stuffy nose, sore throat, cough. They are there all the time, and they always want antibiotics. All the time, upper respiratory. Orthopedic stuff, lots of orthopedic stuff. UTI, we see a lot of UTI. Rashes, lots of rashes, including like hives, poison ivy. And then dizziness, we see a lot of dizziness and fatigue. I guess I'll say fatigue here. Dizziness, fatigue. Head injuries, I guess I would say. Ear complaints, lots of ear complaints, whether it's like cerumen impaction or actual like an ear infection or vertigo, like I said. Lots of stuff with the ears. Nausea, vomiting, diarrhea, that's always a given. We see that a lot. I would say like chest pain. We see a good amount of people that come in with chest pain. My first question is it reproducible with the chest pain? So just keep that in mind. I don't know. I think that kind of answers that to the best of my ability. Recommendations on how to get skills experience besides clinicals for FNP students. Are there in-person courses that you can attend? I've answered this a couple times, and obviously you guys really want to know about different in-person courses, and so I'm going to look into this and see. I'm going to ask around and see if anybody has some good recommendations because, like I said, I didn't do any. Would I ever consider precepting? First, yes, I've already precepted my first student. So hi, Sarah, if you're watching this. I like precepting. I love teaching. I have 2 more lined up. I think I might like offer to people if they wanted to just shadow for a day in the urgent care just to see what it's all about and get some hands-on experience that way. I'm thinking about doing that in the future. Hi, Brittany. I'm preparing for my first NP job in urgent care. I was wondering if you carry any physical copies of books or other resources with you into the patient room. If I need to leave the room to look something up or consult with another provider, what would be the best way for me to explain this to the patient? Yes, I always do have some resources on hand, not really in the room with me. That being said, I do always have my phone on me, and on my phone I do have EMRA and UpToDate and Epocrates all on my phone. So there have been a couple times where I pulled out my phone to like look at EMRA with the patient and kind of like discuss some of the options because like maybe they had a lot of allergies or something, but generally I don't like bring out resources in front of the patient. I also always have the guidelines to the family nurse practitioner book that I've shown multiple times. I always have that in my backpack. I reference that a ton in the beginning, not so much anymore, but I still always have it because I like to have it. Obviously if I do need it, it's there. Your question about leaving the patient room, and I actually kind of talked about this because I did it with my very first patient I ever treated. I'll be like very honest with the patient and very like pragmatic and blunt with the patient, and I've never had anyone like second guess what I'm saying because I think people have to understand that you don't know everything. I mean, they're at an urgent care, especially in the urgent care. If you specialize, people might come to you with more specific questions and expect you to know more about that area because you're an expert in that area. But in urgent care, people have to be understanding. I'm not a dermatologist. I'm not a cardiologist. I'm not a radiologist. I'm none of these things. I work at an urgent care. And so I do the best, and then I reach out when I need to. And I've told patients, like, hey, especially like something like, for example, like a rash.
You know, I'm not a dermatologist. This area can be a little tricky. I have this great reference. I think I know what I'm looking at, but I'd like to go and take a look at this really quick and come back to you.
Or
I think I have an idea of where I'm headed with what's going on with you, but I want to run a couple more tests first before we make any decisions.
And I've said that. I've also said, like with x-rays, if I'm not certain, I'll say,
hey, I'm not a radiologist, but we do have a radiologist read our x-rays after me. And so I'm pretty confident, or I think I know what I see, but I'm going to err on the side of caution.
Which is what I always do with orthopedics, and what you should always do with orthopedics. And you are going to, when in doubt, splint. And so I just be completely honest. I'm going to treat you as though the worst of the situations is happening, in the hopes that it's actually not as bad as the worst, but we're going to err on the side of caution to protect you from further injury or further illness. And that's usually how I phrase it. Really good question, though. Alright, so I have a few more questions here on YouTube, and I think that's going to finish it. But like I said, you guys asked so many good questions. Are there any other fields, specialties that you wanted to go into other than urgent care? And honestly, I didn't know what I wanted to do, and so I just thought that urgent care would be the easiest transition for me, and I knew that I liked like emergency medicine. Now working in the urgent care, I feel like I have a better idea of stuff that I'm interested in, having actually done the role for a year and seeing various complaints. But there's a couple different things that really interest me. I really like, obviously, ER. I like orthopedic, though I'm not that like super strong, and like I feel like you have to like always hold up and like reposition people. But I like orthopedic. Pediatrics, I love kids. And then neurology, I'm interested in like working with patients with spinal cord injuries, because for obvious reasons. So I've thought about it, and I do plan on venturing out eventually and kind of trying some other stuff. What is the starting pay as a new nurse practitioner? So this is kind of, I was disappointed with the starting pay. So I started at $45 an hour working as a new nurse practitioner in the urgent care. That was my initial pay. And for reference, when I was a nurse at the end of my career working in the float pool, I was making $41 and some change an hour. So it really wasn't that big of a difference. That being said, the job I felt was, other than the anxiety of having a role of a provider, the actual job itself I thought was like significantly easier, obviously a lot less labor intensive, and so like that kind of made up for it. Well, I've had one raise now, and I'm going to ask for a raise now that I've just reached a year. When hired, do they give you an orientation? Yeah, you guys, a lot of you wanted to know this. Like I said, I got very little training. That's not the same everywhere. Different places do obviously have different training processes. Ours was just not that much. How long do you spend with each patient, and are you able to document before seeing the next one? So that varies obviously a little bit. It's not very long though. I'm not with the patients very long. And I mean, that again is the urgent care setting. Like compared to the people that I work with that are in primary care, sometimes they'll be in there for like up to a half hour. I'm like, holy crap. That's why I like emergency medicine. I don't know if I could do that. I would say anywhere between like 5 minutes to 30 minutes, and 30 minutes would be the max, and that's because I'm doing like a procedure. Like the other day I did 17 sutures on a guy, and I was in there for a little bit. But usually I'm like 5 to 10 minutes max. I mean, it's not very long. Go in there. I've got it down now to where I know the questions to ask. Oftentimes now, working in the urgent care, I know what I'm going to diagnose the patient with before I leave the room. But yeah, and sometimes I have to go back in, like if I'm waiting for a test or something, but it's usually not very long. And then, so are you able to document before seeing the next one? It depends on how busy we are. Like I said in some previous videos, there's a couple things that we always have to have done before the patient can leave. So we always need to have like their diagnosis and their plan of care and their dispo done before they can leave. So those I always have to have done. That being said, I do try and like usually make a quick note in the HPI so I can kind of jog my memory if I have to go back to charting. That happens probably more often than the alternative, which is that I finish my charting before seeing another patient. But now I almost never go home with charting, so there's that. Where in the beginning I was going home with a lot of charting. Now I'm able to finish my charting before clocking out. How long did it take to be comfortable in that setting? Yeah, so it took me about 6 months to feel comfortable, like that I wasn't going to have a panic attack. And then a year, where I'm at now, where I feel just very confident. I would say about a year. Yeah, I think that's it. I think those are all the questions. If I missed any, I'm so sorry. I tried to answer as many as I could find. You guys had a ton of questions for me. and a lot of really great questions. Like I said, I'm going to get back to you guys about different courses and like continuing education credits and stuff, because that's something that I'm interested in learning more about too, and so I'll let you know what I find out. Sorry I didn't have as much information there for you guys, but definitely working in the urgent care, if you're considering going to work in the urgent care, one, try and have a clinical there if you can. That will help you a ton. And then watch a couple of my videos along with some other stuff. The suturing one is really helpful, and the orthopedic one is really helpful for just getting a better grasp of your skills. Obviously, there's lots of stuff that you see outside of those, but those were the areas that I was nervous about because I really had very limited exposure with x-rays other than my nursing experience, and I had almost no experience with suturing. I only did it, I think, once or twice in my actual urgent care rotation on a person, aside from like practicing at home like a crazy person. So yeah, that's my advice to you guys. Hopefully it was helpful. Hopefully I answered your questions. Like I said, I'm really sorry if I missed any. I'll do this again for sure in the future. If you have more questions for me that you'd like answered, you can leave them in the comments below, and next time I do a Q&A, I'll try and pull from here. I'll also post it in other places too, but just keep it in mind that I will try and do more of these. You guys are amazing. Don't forget to learn something new every day. Thank you so much for being part of my community. Don't forget to like the video, subscribe to the channel, and I'll talk to you guys very soon. Bye.